Hi everyone, this is Christine, and today I will be presenting my capstone project. The title of my project is called Enhancing Effective Communication in the Radiology Department with Attention to Decreasing Wrong X-ray Orders by Providing Registration and Central Scheduling with an Educational Course. The objectives and reasons why I chose this project include effective communication is really essential to a successful work environment in the radiology department. Decreasing wrong X-ray orders will increase productivity and time to focus on patient care. As radiologic technologists, patient care is a huge priority in our department and is something we always focus on providing, and we want to do so to the best of our ability. My final objective is effective communication will allow for increased teamwork and boost the morale of the X-ray department. In our X-ray department, every time a wrong order is put in, it disrupts the workflow of our department and allows for frustration within the department, including technologists delaying their exams, and therefore it just causes a lot of disruption of workflow in the department. For my research, I included a few articles that really make a big difference in explaining how communication is essential in the radiologic department and in healthcare, and also why decreasing wrong orders is so important. The impact of communication in healthcare is an article that reiterates how important effective communication is in the workplace. There is definitely a positive correlation between effective communication between employees and also with excellent patient care. If communication is increased, this will allow for patient care to be increased that's provided by the employees. Job satisfaction also increases when the lines of communication are open in all aspects of a healthcare department. Errors are reduced when effective communication is practiced, which results in a positive work environment for patients and employees. When errors are decreased in the workplace, this allows for a smooth flow and transition between patients. We don't have to focus on trying to fix a wrong order, and most of the time this stems from registration or central scheduling. I also researched an article called The Antidote for Radiology Errors. Wrong errors are greatly due to lack of training, time constraints, belief that someone else will fix the error, and these are the main problems why wrong orders occur in the radiology department. Wrong orders will definitely disrupt the flow of excellent patient care, and the disruption of workflow can result in more errors and mistakes. My final research is called Effective Communication Can Save Lives. Effective communication is essential when discussing patient history and ordering patient exams. If an incorrect order is placed, it can result in delay of a patient's treatment. This can really cause problems for physicians and essentially causes the patient to have a great delay in their results if a wrong order is put in. Communicating with empathy and understanding is important with all types of personalities we encounter. In our jobs, no matter who we interact with and communicate with, we may encounter all different kinds of personalities. And no matter what, we need to communicate with understanding and patience and also empathy to be able to communicate with each other and come to a solution for whatever problem is given. The key stakeholders in this project include radiology management and leadership, registration management, registrars and central scheduling, and the chief radiologist. The final and one of the most important stakeholders is my coworkers. I feel as though I need to be able to convey to them how important this project is in order to decrease wrong orders in the X-ray department. All of my coworkers are really on board with wanting X-ray orders ordered incorrectly to be decreased, and I have communicated and discussed how I will try to do this by providing registration with an educational course, and they are completely on board and supporting this project with me. The process of buy-in with these stakeholders include, again, radiology management and leadership. In order to approve the time spent educating the registers and central scheduling as well, registration management and registrars themselves in order to set up a time to educate the registers, the head of the radiology department, which is Dr. Calandra, and I have to try to receive his support and approval for the benefit of the department. And finally, again, coworkers, in order to receive their help in tabulating the most common wrong X-ray orders. Through the help of my coworkers, I have been able to come up and tabulate the most common X-ray orders in the department. The top wrong X-ray order that is put in by registration is hip X-rays. These are always ordered incorrectly, primarily, and this is because a lot of the times the registration will put in the wrong amount of views, and also the completely wrong order in general. For example, a correct order for bilateral hip X-rays is bilateral hips with pelvis, 3 to 4 views. Most of the time registration puts in hip X-ray 1 view, hip X-ray 1 to 2 views, or they will put in an order without a pelvis. Sometimes they will also put in the wrong side of the part of the body. So they will put in the right hip instead of the left hip. And this is a huge problem when it comes to X-ray orders, because this will completely mess up the X-ray order, and also when a radiologist will read the order, it will be completely the wrong results.